Our Marley Capper attended a Zoom conference call and has more.
When Robin Taylor was walking around downtown, she probably wasn't thinking about the COVID numbers. But after we asked her, she said,
my son is in school here, and secondly, my husband sees his parents quite often, and they are in their 80s, and we do not want it to get back to them since they're a vulnerable population.
It's important for her to be up to date on the cases. UT has been building pandemic preparedness tools for the state of Texas since the swine flu pandemic back in 2009 with their pandemic app.
The user can put in, this is going to be a deadly pandemic, a mild pandemic, it's going to spread quickly, it's going to spread slowly, and then they can watch how it might play out across the state and see the impact of different kinds of intervention measures like school.
And with COVID-19, leaders in the University of Texas at Austin's COVID-19 Modeling Consortium have been advising local, state, and national leaders, including the Centers for Disease Control and Prevention and the White House Coronavirus Task Force.
The goal of this dashboard is to provide up-to-date information for the general public, for schools, for healthcare providers, hospitals, and policymakers from local to county to across the state to help them understand what the situation is as it unfolds and to protect our families and our communities going forward.
So we have plateaued. You don't want to get too comfortable and then have the numbers spike up.
And the UT dashboard will help parents like Robin stay up to date with the probability of future cases to keep her family safe. And with the dashboard,
you can look up what the situation is in your own communities.
So let's take a look at the UT dashboard. You're going to want to start by selecting your Texas area. Luckily, Abilene is first, so go ahead and click that. The first one over here that you'll see is the reproduction number, which is less than 1%, which means, according to Dr. Mayer, the epidemic should be declining in the Abilene area. The next is going to be the probability of the epidemic growing, which is less than 50%. The third one over here is the 14-day change, which is currently at 2%, which means over the past 2 weeks, we've seen a 2% decline in cases. There's other maps that are interactive you can view on the website. In Abilene, Marley Capper, KRBC, Abilene's local news.